We do have a lot of questions, and we'll try to cover some of them now, but clearly the workshop sessions this afternoon are intended to deliver an opportunity for you to ask detailed questions on a number of key areas of the funding framework, the purchasing framework, excuse me, governance, and we'll have an opportunity to discuss it in detail. Carol, I'd like to start with you. All of this is about what we do for our communities. I've described this previously, indeed, to some of your constituents as a once-in-a-generation opportunity for significant healthcare reform. Whether you like the Rudd deal or the Gillard deal, or the governance arrangements in New South Wales, the significant health funding changes, this is our one go in the working life of most of us in this room to deliver major reform in the health system. So from a consumer perspective, what does that mean, and how are we going to know that we've achieved what we should be achieving?
Well, thanks, Rowan. And yeah, I agree, it is a once-in-a-lifetime opportunity to get this right. I was looking through some of the documents when the IPA was first pronounced by the government and the activity-based funding was put forward, and I had trouble finding any particular quotes from then Health Minister Nicola Roxon, or anybody else for that matter, that related really to achieving better health outcomes. And for consumers, that's what this is really about. We talk about efficiency, we talk about throughput, we talk about all those sorts of things, but we haven't really talked about the real outcome. And it was really refreshing this morning to hear Minister Skinner and Mary Foley talking about how this is really about centering care around patients and around being open to scrutiny and to transparency, because ultimately that's what drives performance. So it was really good to hear that. From a consumer perspective, as I said, health outcomes are really the key focus. It's not about efficiency, it's not about throughput, it's about health outcomes. And if health is the goal, and ultimately that's what the health system's about, ultimately the services need to meet the needs of consumers, because that's the reason the service system exists. Then we have to look at health outcomes. And that must be a key driver of any kind of activity-based funding, cost efficiency and so forth. It needs to be flexible, it needs to be responsive to the needs of healthcare consumers. And I think it's really important that we get this right so that we don't end up with unintended consequences that produce poorer health outcomes. And there is a potential for that to happen as well. So we need to make sure it's monitored and adjusted to ensure that we don't end up with that kind of unintended consequence. From the Consumers Health Forum perspective, we're really interested in a more normative health outcomes or best practice based pricing model rather than the sort of output model that we have. And we're hoping that over time that's where things will go. We want to see health outcomes rewarded. It's as simple as that. We want to see, have I got a lot of time here? I'm going to try and... we want to see nationally consistent consumer experience and satisfaction data. And, you know, I know that the Performance Authority and the Pricing Authority are separate bodies, but we'd really like to see performance data driving better outcomes in terms of driving the price that we're paying for health services. So we'd like to see those two things merge together sooner rather than later. And there's three reasons for that. And that, you know, the national data, I think, drives improvements. And we know that what gets measured gets done. It's as simple as that. Consumers, if they have a positive experience of the health system, tend to get better health outcomes as well. And ultimately, we need to measure real health outcomes. And we know that transparency and making those outcomes public drives better performance. I think we have to take into account the whole person, not just in this pricing formula looking at the individual diagnosis or the procedure or the particular intervention, but the circumstances of the person. and their needs. And it was refreshing to hear a clinician this morning saying, it's about what sort of patient has the disease, not the disease the person has. I think we need to focus more in terms of the total need of the consumer. We have welcomed penalties for poor practice because we want to see the drivers in the system geared more towards better health outcomes, obviously, but we are concerned that there may be some disincentive then for clinicians to report, so we need to keep an eye on that. We're interested in the block funding and the adjustments around some of the more complex clients in the system, so we don't end up with cherry picking and we don't end up with adverse consequences for rural and remote communities where there's volatility and fluctuations in demand. So it's good to see that, but I guess we need to make sure that those loadings that were talked about this morning do address all the relevant groups here, and that we are monitoring that and adjusting for those groups that really do need that, and that there is innovation funding that looks towards the more complex needs groups. Obviously, the continuity of care and the dollars following the consumer are a really important consideration when it comes to hospital services and out-of-hospital services. So community services, aged care, multi-purpose services, and I note that drug and alcohol is not going to be included in this price. I think they're things that are critical to consumers because it's about getting that kind of system performance that meets the needs of the consumer, not having siloed funding that disintegrates care. So we're going to judge this not by the dollars that are going in or in terms of the Commonwealth's role or the state role, or not in terms of dollars coming down, but better health outcomes. And ultimately, I think the health system rewards that take account of the real needs and the real outcomes are going to be really critical to getting this right.